It can't differentiate between the healthy and the bad cells, and so it just attacks, which is what results in inflammation. So currently there's about 200,000 to 3 million cases diagnosed a year just here in the United States. 90% of them are women in childbearing years from about 15 to 45. It can be medically managed, and it will occur anywhere in the body where there's an organ. So your largest organ is your skin. Most lupus patients are going to have some sort of skin involvement. You may have seen the purple butterfly or a butterfly, which is a symbol for lupus patients because they often have a mylar rash across the bridge of their nose and their cheeks, and that's why it's called the butterfly rash. And the symptoms are extreme fatigue, headache or muscle aches, painful or swollen joints, fever, weight changes, anemia, low red blood cell count or low blood volume, swelling in your feet, legs, or hands, puffiness around your eyes, pleurisy, which is basically pain in your chest when you're taking a deep breath, the butterfly rash, sensitivity to light and sun. Some lupus patients are sensitive to UV light in a room, so they have to wear filtered clothing. Abnormal blood clotting, Raynaud syndrome, I don't know if you're familiar with that, but that's basically where the edges of your extremity actually turn so cold that they turn purple to white. And that happens in your feet and your fingers, Raynaud's. Then of course hair loss and mouth or nose ulcers. There isn't any one test or biopsy that can be done. However, if you test positive for the anti-nuclear antibody ANA test, and you have 4 out of 11 of these symptoms, you probably are on your way to the diagnosis of being diagnosed with lupus. Something that we understand is that there have to be 3 things in place, not all at once, but they have to occur. When the third one occurs, it can present itself. So the first is some sort of hereditary, or excuse me, that's not the correct word, not hereditary. It's being predispositioned for an autoimmune disease. So if there's a history of any autoimmune disease, be it diabetes, be it rheumatoid arthritis, so that's one element if you're predispositioned for that. The second thing would be an environmental factor. So, for example, the lupus patient that I'm going to talk about today contracted chicken pox as an adult. And then the third part is the hormonal unbalance. And that's why most lupus patients are diagnosed, because most of them are women during childbearing years, because that is when you have the greatest influx of hormones unbalance at that time. And that's why it seems that in a first pregnancy, that is when lupus tends to flare and when it's diagnosed. In the meantime, a lupus patient is probably being diagnosed with many of the 11 diseases that compromise lupus. And as you can tell from the symptoms that I told you, those are specific diseases, as you would understand. So, to give you a little bit of statistics about lupus patients, and it's very prevalent in women of color. So Asian American women are 3 times likely to get it. Asian American women, twice as likely to get it. 2 out of 10 is what we're talking about. And Native American and Latina women, 1 out of every 10.
1 out of 10?
Yes.
Wow.
Yes.
1 out of 10 what? 1 out of...
One out of every 10 lupus patients is a Latina.
Okay.
Yeah.
That's just a genetic thing?
You're genetically predispositioned for an autoimmune disease, yes, but it's not hereditary.
It's a huge number.
It is huge. Some of the medicines that are common in treatment, because what you need to understand is the diseases, first of all, lupus has no cure. Lupus is many diseases, and there is no one treatment or cure for any of those. So some of the medicines that are used to treat the symptoms are the non-steroid anti-inflammatory drugs, otherwise known as NSAIDs, anti-malaria drugs, hydrochloroquine, also corticosteroids like prednisone. That's when you have major organ involvement, and then the immunosuppressive agents that try to limit the damage to the major organs that are affected. 25 years ago, if you were diagnosed with lupus, you had a 40% chance of living 5 years. So this lupus patient is a female, diagnosed at the age of 31, 7 months pregnant, and suffered a stroke. Immediate renal failure. She was told that they would have to, that her body was starting to abort the baby. So they were going to try to monitor that and see if they could hold the baby. But the baby's heart rate and brain function and breathing was being affected by the contractions of the body trying to eliminate the baby. So the baby was taken by emergency cesarean and born at the age of 23 gestational weeks at 2 pounds 11 ounces. And although the baby was healthy, the baby was underdeveloped, greatly underdeveloped. His ears were still attached to his head, so they hadn't folded over yet. And although the mother was very ill, she survived, and the baby also survived. And then she continued with a lifelong search of dealing with this disease, and finally was told that she had lupus. Well, she had never heard of it before. Her mother was in the room at the time, and her mother knew that a friend of hers had passed away from lupus, but she had never said anything because she didn't think of anything. So mother's quite astounded that that her daughter had this diagnosis. It turns out that this mother had another daughter, a maternal half-sibling, and that daughter has another mysterious illness called acromegaly, which is the giantism disease. I don't know, some of you may have seen the movie Mask, where the individual's features and bone structure just continues to enlarge, and that's because of the high level of testosterone in the body. And so this mother was quite astounded that she has 2 daughters, and they're maternal sisters, and they have these severe diseases. So the family, looked at history and things, but other than what the patient herself could find out and discover through self-education and patient education, is really the best way that she could deal with that disease, was to, educate herself. So she didn't look sick. She said that if she had a dime for every time somebody said, "Well, you sure don't look sick," she'd be rich, right? She said people would say, "Good morning, how are you?" And she would say that, well, she just would say, I'm fine, thank you. Right? It's too much to explain of what she was feeling. She had a headache for days, couldn't feel her feet. She wanted to drink a Coke, but she couldn't tell her arm to pick it up. That was because she was having the stroke. Then she suffered from continuous headaches and migraines, and she knew that something was very, very wrong in her body. She became tired. It was hard to get up. She said it was very painful to even sleep. And the depression was so horrible that sometimes she said she just couldn't get up and face the world. There wasn't a day without pain, and sometimes when she woke up, she was so puffy that she couldn't even wear her own wedding ring because her extremities were so swollen. She was told by the high-risk OB that she needed to undergo immediate sterilization because she should not ever become pregnant again. And the rheumatologist that was following her said, I recommend that you don't make that decision, because if your baby doesn't survive, you could still there is a possibility that you could still entertain another pregnancy. But you're going to have to stay, she had to stay within 25 miles of her doctor. She had to, strict orders from the doctor. No pregnancies for 2 years. She couldn't take birth control pills because of the hormone issue. So there wasn't a medical way to prevent the pregnancy. So just short of those 2 years where her doctor said that, she should stay away from the pregnancy, she and her husband discovered that they were pregnant again. And they actually went through a brief mourning process, assuming that they could not maintain the pregnancy, that they would have to abort the pregnancy. So apparently she called her doctor, I guess on the weekend, and her doctor said, well, do you want to have this, do you want to carry this pregnancy? And they said, yes, of course. She said, that's fine, you can do it, but you're going to be high risk, and but if you want this baby, you can have this baby, but this will be your last pregnancy. You will have to probably have another cesarean, and you will probably have to have sterilization at that time, immediately at the end of your pregnancy. So she sort of went through life with now 2 children. Everybody knows what it's like to have a newborn and a toddler, or anybody who has had more than one child, because that second one that shows up changes everything.
1 and 1 is more than 2.
She was, tired of having surgery for this and that. She says her husband was quite wonderful, that, he was always there by her side, even though he didn't understand the disease, could not fathom what this was about. She did a lot of sucking in her pain and the hurt so that people didn't think that she could accomplish the things that she could accomplish. And from one day to the next, she doesn't know if she's going to feel good or really sick or end up in the hospital. All she knows is this is her life. And one time her husband had to call 911, and it scared him because she just couldn't control the pain. She says she's going to make it, and she says that you see what you see because it is whom she chooses to be, because she has people who love her and appreciate her. She takes advantage of the good days, and it's probably because she says she has a great sense of humor, and because she genuinely enjoys every good day. She says, Lupus, you're not going to bring me down today. You just don't know how hard it is for these people. You don't know that every day when she awakes, she has a pain level of at least 3 to start her day with. And she has some, obviously she's going to have other related diseases, which is rheumatoid arthritis, fibromyalgia, and hypothyroidism. And the hypothyroidism basically is a completely inactive thyroid. It has no activity at all. So with each of those diseases, then you have the pain medication and the meds that need to help manage those individual diseases. But she says, this is my life. I'm going to fight. Pills, no pills, not knowing from one minute to the next if she's going to feel well or sick. She tries to be there for friends and family that just really can't understand how she can look well and be ill in the next moment. She says, the pain is so intolerable, but I'm going to deal with it and fight like a girl, with courage, grace, class, and lots of laughter, even if it comes with tears. She says, I'm going to manage it and make people aware, and I'm going to love life. I don't know what tomorrow brings, but I'm blessed because I'm loved and I'm here. Don't bring me down today, Lupus. So, I'm going to say to you, if you see me cut a joke or see me laughing, it's because I love life, and I'm appreciative enough that I have lupus, but I have life. And that lupus patient is me.
You?
Yes. And this is the daughter that I was allowed to have.
Oh. Sylvia,
Questions?
we know so little. And I'm still reacting to your last statement because I was going to ask how she's doing, and we know how she's doing. But you're in pain all the time.
Yeah. All the time. Pain, sleeping is very painful. Being still is very painful. But you just learn to sort of, you figure it out. You just figure it out, you know. I understand that Jerry's father passed away from lupus at the age of 63.
68, yeah.
68.
He was ill for weeks and months, and they couldn't diagnose it because it's
Very hard to
It's
diagnose.
very rare in a
Even rarer in men.
middle-aged male, white male. It's, you know, demographically, it's
Right.
unusual in that population.
And
So-
sometimes men think that lupus is a women's disease, but it's not. And when men get it, actually, after the age of 60, there are equal number of women, female and male patients after the age of 60.
Yeah. Well, this was 1988, so I think the medicine has improved a lot since then. But he was
Yes.
hospitalized in Redwood City Kaiser for weeks, and they couldn't diagnose it. They thought, well, maybe it's TB, maybe it's this, maybe it's that. We can't figure it out.
Yeah, they're looking at, maybe it's this, it's a list of 11 diseases that they're looking at and trying to rule out.
I mentioned this story to Sylvia. I traveled to Philadelphia for a Rotary National Convention with Ed Trucco. Ed Trucco was our second president in this club. I was going to succeed him as president-elect, so we went to Philadelphia. We took a red-eye on a Saturday night. We got to Philadelphia, and I heard him taking a turn for the worse. So I was on a plane Sunday morning before noon coming back, but he passed before I got back here. But I mean, weeks and weeks in the hospital, they couldn't figure out what was going on. So it's an insidious disease process. And in
Yeah.
those days, it was very difficult to
I
diagnose.
was in Foster City having the stroke, and I had called my doctor and said that I didn't feel well. She said, I'm at Peninsula Hospital today. I want you to come in and see me. Well, in between that time, after I hung up the phone, is when I had the stroke. So the paramedics, I kept telling them, you need to take me to my doctor at Peninsula. They wanted to take me to Mills. I said, no, my doctor's at Peninsula. My doctor was just leaving the building because, you know, I never showed up. So she figured I got better. Then that's when they brought me in, and she said, you know, you're very ill. Your kidneys have shut down. Your blood pressure is through the roof. We need to, you know, we're probably going to have to deliver your baby. So we're going to transfer you to Children's Hospital because if we deliver your baby here, you will be separated from your baby. So the best thing is that we transport you. So another ambulance right up to the city, to Children's Hospital, and that was Sunday afternoon. and got treated overnight, but by Monday morning, they had to deliver my son.
Now, it was a heart lupus, or was that separate? The
His heart
stroke.
rate?
No,
Oh, the stroke?
The stroke.
That was the symptom that manifested,
Wow.
yes.
So that affected the heart. I mean,
The stroke was in my brain.
okay.
Stroke was in my
okay,
brain.
all right.
Was that Rudy? Your son,
Rudy,
was?
my son, yes. I'm very blessed to have the two children that I have. And now I know why I only had two, because I adopted all those other ones. I wanted a big family, I got it.
So I got the video,
Oh, you did? Okay, great.
if you want it.
Yeah, sure.
They did an autopsy, and I had a pathologist friend who I asked to walk me through the
No.
autopsy report.
No,
Said it-
no. No lupus. No lupus. Lupus is one of those things that takes over somebody's body and you don't know anything about, and it doesn't affect one person the same way it affects another. It's really a cruel mystery. We've got to find a way to get through this. No lupus. Go to lupus.org/no. There is hope.
So, on your table, I left you some purple ribbons, and I'm gonna ask you and challenge you to wear that today. Because as of today, if you didn't before today, you know a lupus patient. And so I'm gonna ask you to wear that in support of Lupus Awareness Month, which this week also happens to be Women's Health Week. So I'm gonna challenge you to wear that today. Thank you.
Is there a family history of this?
Not of lupus, no, but, you know, my sister has that other very rare disease.
The giant thing.
But it is genetically predisposition. All immune diseases are genetically predisposition. So you don't inherit diabetes from your family. Having diabetes in a parent, then having a child, you're genetically predispositioned for any autoimmune disease, not just diabetes.